So when we do a newborn exam, we're first going to look over a baby from head to toe, front and back, and see if there's anything unusual with baby's appearance. We're going to look over the skin and see if baby appears to be jaundiced, if the skin is peeling, if there's any lanugo, vernix, birthmarks, or anything else that appears to be unusual. There does not appear to be anything like that with this baby. We're going to start at the top of the head and check the fontanelles and the sutures. We're going to take a look at the eyes and the ears, the nose, make sure that the nostrils are open, baby is breathing, the mouth. We're going to check the palate, and while we're there, we can also check the sucking reflex. We can also look to see if baby is able to lift up their tongue and look for any visual appearance of a tongue or lip tie. Then we can move down to baby's clavicles, and we're going to make sure that the clavicles appear to be intact. We're going to check the size and the shape of the baby's chest, the location of the nipples. And we are then going to listen for lung sounds. So we can listen to the lungs. And then we can also check baby's heart rate. And we want to listen in all 4 quadrants of baby's heart. While we are still listening, we can also listen for bowel sounds. Again, in all 4 quadrants of the bowels. We can check the abdomen for any unusual masses that may be present. We will look at the cord stump site and make sure that there are 2 arteries and 1 vein. We will also check for any immediate signs of infection, and then we're going to check the baby's genitals. If it is male, we will check to make sure that both testes are descended. If it is female, then we will check the inner and outer labia to make sure that they appear to be fully formed, and that all parts are present and accounted for. We can check the baby's reflexes, so the Moro reflex, the startle reflex. We already did the sucking reflex. We can do the stepping reflex. So we can turn baby over and we can check the spine, make sure that everything appears to be as it should. We can check the top of the buttocks and make sure that there is not an open sacral dimple. We can, while baby is in this position, check the crawling reflex and see if baby is attempting to crawl. We can also check the anus and make sure that it is patent. Turn baby back over here. So we can check the arms and make sure that they are appearing to be symmetrical in their length, that the fingers and the toes, that there are 10 fingers, 10 toes, and we can look for any webbing. When we're looking at the hands, we want to look at the creases and make sure that there are 2 creases on the hands as opposed to just 1. And we also want to look baby over to make sure that there are not any tufts of hair or anything like that in places where it would not normally be, such as making sure that there's not any at the base of the buttocks. And then we also want to check the reflexes on the feet, and that is our newborn exam.